Strict lockdown regulations may not have done much to slow the COVID-19 spread in South Africa. That's according to actuary Barry Childs. He led the official Actuarial Society of South Africa's modelling group on COVID-19, and he joins us now to explain this further. A very good afternoon to you, Barry, and thank you very much for your time. So what exactly do you mean that, the lockdown, the strict lockdown, because it was, probably didn't do what it was intended to?
Well, just to make a small clarification there, it's not precisely what I said in my presentation at the Actuarial Convention. It certainly slowed it down. The question is, whether the lockdowns were responsible for the turning of the tide for COVID. So as during strict lockdown, cases continue to rise, despite best efforts by citizens, and then as lockdowns were being eased, the tide of the epidemic turned, and new cases started to decrease. So what I was saying was that there are other factors at play other than lockdown in the turning of the tide against COVID.
What were those factors, if you're able to just indulge us?
Yes, sure. So what became clear as for example, in the Western Cape did seroprevalence studies of antibodies levels in the communities, showed very, very high levels of antibody prevalence, much higher than we've seen in some other countries, which suggests that the virus made its way through those communities despite lockdown, particularly the informal settlements, saw very high levels of COVID penetration. And that means that it effectively burnt out in those communities, from what we can tell. And so the good news is that means if we do have anything like a second wave in South Africa, it should be much lighter and less severe than is being seen in some other countries.
Do we know if perhaps it'll be easier to respond to the second wave, because we're seeing countries abroad enforcing a heavy lockdown once again because they're dealing with their second waves respectively? Yes.
So if you remember, the reason for going into lockdown in the first place was to buy time, to learn more about a virus that we didn't know a lot about at the time. We were very concerned for South Africa in particular because of our high HIV and TB prevalence. There was no data yet on whether that would cause additional complications, mortality, morbidity for those immunocompromised patients. And now we know a lot more. There was an enormous amount of fear early on, sort of March, April, around the potential overwhelming of South Africa's health system, particularly the public health system. And despite those fears, and despite a comparatively high mortality level internationally, our health system did manage. There was some spillover into some of the temporary facilities and a small spillover into private facilities. But our system managed as well as it could, certainly better than some others. So that, coupled with the fact that we will now have a fairly high level of penetration into the communities. The second wave, if there is one, will be lighter. We know that our health system can cope. So all of that is good news from where I'm sitting.
Now, we obviously know that our healthcare system, unlike Europe, for example, or the Americas, is a little more inferior. And I hear you saying that it'll be better, well, we'll deal with the second wave should it come a little better, because we now understand this virus a bit more than we did when it started several months ago. But do we really have that confidence? Do we know if the healthcare system, I know you're not a healthcare professional, but do we know if the healthcare system has that confidence that with the second wave it'll be easier to deal with, because we now have a better understanding rather of what this virus is and how we go about dealing with it?
Very much so. So there's still deep concern about the level of infectivity. It's a very infectious disease, but we are much better prepared in terms of knowing who the at-risk patients are, what kind of comorbidities and lifestyle characteristics mean that you're at risk of severe disease. Age is the strongest factor, so we know now much better who's more at risk. We know better treatments. If I remember the conversations from March and April, it was all about ICU and invasive ventilation, etc. And we know now that low-dose dexamethasone and high-flow nasal oxygen and other forms of treatments that actually have much better outcomes. And so all of the healthcare professionals that I've spoken to in the health system in this area are more confident. And we also know from a capacity point of view that we will be able to handle it from a volume point of view, and that was the big concern in March and April. And of course, everybody. Yeah, go ahead.
No, sure. Please continue.
I mean, unfortunately, we can't neglect the rest of the health system. The studies have shown that people have neglected to go to the healthcare facilities for everything from vaccination to cancer diagnosis to collecting HIV and TB medication. And so we do have to balance those needs, the needs of other people with other healthcare difficulties and challenges and illnesses with those that COVID demands.
All right, Barry, thank you very much. We're going to leave it there with you. That's Barry Childs. He is an actuary, and he led an official Actuarial Society of South Africa modeling group on COVID-19, just saying to us that, it didn't do what it needed to do in terms of turning the tide and flattening the curve, did the harsh lockdown, but that we will be ready for a second wave should there be one.